Hello, my name is Dr. Ziad N.Arandi. I am assistant professor in psychiatry at النجاح hospital in Nablus in Palestine. Today I want to present a short presentation about panic attack and panic disorder. As we know, is panic attack, it is sudden and unrespectful, intense fear. Fear here, it is very intense and occur suddenly. The duration of this fear is was about 10, the peak of the episode about within 10 minutes. The episode, all of the episodic attack continue for half an hour and can be extended to more than an hour. The panic attack, as we know, it is occurs suddenly with many symptoms and signs related to sympathetic nervous system, such as 4 of the following symptoms: fear, dyspnea, breathlessness, fear of death, fear of losing control, sweating, palpitation, and nausea. Could be there is frequency of micturition or frequency of defecation. It is accompanied by cold sweating and also fear of having heart attack or feeling that he is going to death. It is accompanied by derealization and depersonalization. 4 of these symptoms can we could diagnose as panic attack. It occurs once or twice normally in our life. With regarding to the panic disorder, as we know, if the panic attack occurs and the patient following it by overthinking about this attack and how it is happened and the complication of it for 1 month, and embed his social and working, it is called panic disorder. In DSM-5, we diagnose DSM-5, we diagnose panic attack disorder if there is recurrent unpredictable frequency of panic attack, may be extended to once per week, for 4 times per month. Can we diagnose as a panic disorder? We should exclude it in the diagnosis. There is no medical condition or substance use, and it should be embed his social and occupational function in his life. With regarding the epidemiology of panic disorder, it is more frequent in women than in men, in age late adolescent or 20s. Prevalence is about 3.8% of the population is suffering from panic disorder. In panic disorder, there is a multiple causes for this disorder. It could be genetic factor, familiar factor, constitutional factor in his personality, biological factor, and psychological factor. Let us take in details of each of them. From early raising or childhood development, could be the child could be physically or emotionally or sexual, maybe has abusing, and this is remembered with negative discharge in his unconsciousness, and maybe raising during his raising to adulthood, it is accompanied with his awareness. Could be familiar tendency, more than one person in his family suffering from panic disorder, and he learned about this disorder and how he is behave, and this is called learning process theory. With regarding to genetic factor, multiple research prove that there is genetic and hereditary factor for this disorder. With regarding to the personality, some personality have the traits of fear, and this traits can raising up with him, and after adulthood, he be vulnerable to stressful factor which make him predictable for panic attack and later on to panic disorder. Inside from the psychological process or biological process, there is a theory saying that it is called introspective, that when there is a stimulus which occur suddenly or a situation that the person exposed, it is send messages or stimulation for or vibration sensation for the amygdala, which is concerned about this stimulation and send to understanding this stimulation from the hippocampus, and the hippocampus viewing this picture that this is an anxiety. Later on, the amygdala send her messages to the midbrain locus coeruleus, which for the adrenaline release and the stimulation of the sympathetic nervous system. With its stimulation, as you know, there is a palpitation, insomnia, sweating, abdominal pain, frequency of micturition, feel of suffocation, feeling of cold sweating, numbness, and so on. Even there will be derealization and depersonalization. After, as we know, the duration of the panic attack about half an hour. After that, the parasympathetic overlap the condition and the patient be more calm. Let us say something about the management. Also, in diagnosis of panic disorder, I forget to say that we should exclude medical condition. We should exclude any substance use or any effects from any drugs he taking. For management plan, it is not harmful to do some investigations before we started treatment, which include laboratory investigation and psychometric investigations. With regarding to the biological lab investigation, we can make some tests about the thyroid to exclude thyroid toxicosis, for the heart, for the pituitary gland, to exclude diabetes mellitus. For the respiratory system, it is very important to exclude any defect in the respiratory system, because asthma can giving some panic attack. If we excluded organic causes, so we come to the treatment as a psychological treatment, which is contain cognitive psychotherapy, supportive psychotherapy, focal dynamic psychotherapy, analytic psychotherapy, giving more awareness, breathing relaxation training, breathing exercise. All of these methods can reduce and make a palliative treatment for panic attack or panic disorders. We can, as we know, it is the efficacy of this psychotherapy. Exposure therapy, it is very important also. Relaxation training, it is very important. The efficacy of this psychotherapy, it is about 50%. With addition of drug, it may raise the efficacy of this to 70 or 80%. Usually the patient responds to treatment after 3 months, and we should continue the treatment for 1 year. For the psychotropic drug, The drug of choice, as we know, is selective serotonin reuptake inhibitors, venlafaxine, ممكن paroxetine, and Zoloft, lusertraline, can good effect for even anafranil is clomipramine is best drug also for this drug treatment. Benzodiazepine, it is also a drug of choice, but we should take in consideration to do full evaluation for this, the personality of the client, to avoid habituation and addiction. Lorazepam, it is a very good drug. Rivotril or clonazepam, it is a very excellent drug for alprazolam, also drug of choice for this management and for as a treatment, and we should continue it for 1 year. The best way actually is if we evaluated the personality between both of them, we can give benzodiazepine for 3 weeks with antidepressant. Until the antidepressant started to give its effect, we can stop the benzodiazepine. The prognosis, it is, as we know, there is no totally curity, but there is many researching saying that the prognosis is good if we take combination for both psychotherapy and drug therapy. Thank you for your listening.